Today on BizTech Health and Wellness Show, the topic will be on childhood eczema. I'm Sharon Chang, and with me is Dr. Jenny Tan Yan Ling, consultant pediatrician and pediatric dermatologist at Subang Jaya Medical Center. Welcome to the show, Dr. Jenny.
Thanks, Sharon.
Dr. Jenny, can you explain to us what is eczema?
Okay, eczema is a form of inflammatory skin disorder that commonly we see in children. It will cause rash that is red, itchy, and sometimes can be even weepy and swollen. And this definitely is very distressing to the child and also the parents. Okay, let me share screen here to show you example of a child with eczema. Okay, as you can see, this child is suffering from eczema. That's very red and oozy rash on the face. And this definitely is very itchy and uncomfortable for the child.
How old is the child, Dr. Jenny?
This child is about 6 months old.
Okay, and how long has he been having this problem?
He has this problem since 3 months old, but initially it's only started with a little bit of redness, which a lot of people deem it due to milk rash. However, it becomes worse as you can see in this picture. This child actually also has secondary infection of the eczema. That's why you can see that the skin is crusty, weepy, oozy, and has caused the child to be unable to sleep. I'll go to the next slide. As you can see, the impact of the itch due to the eczema definitely will break any parent's heart. A mother that loves the child so much just can't stand to see the child suffer from all this. And therefore, any child with eczema, I think that should brought to attention and get it treated and not let the child suffer. Okay, here I want to share with you a video. As you can see, this child is, don't think that a baby cannot scratch. Look at this child. Despite being very young, less than a year old, but because of having eczema on the skin, you see the child is very distressed, using the leg to rub against each other, scratching the head, crying, it's as though the child is making a dance like that because it's just so uncomfortable. The child don't know where to scratch, but all the child knows is the child is very uncomfortable. So the impact of eczema is indeed very big for a child. And for those with young child, I'm sure you know that if the child don't sleep, don't ever dream the whole family will be with the child and nobody at home can sleep.
So, Dr. Jenny, you mentioned earlier and you showed us the slides, but how prevalent and common is childhood eczema actually?
Okay, prevalence of eczema in Malaysia is about 20%, which means 2 out of 10 children have some form of eczema. So actually that's quite common. And out of all these, 90% of those actually will present with some symptoms starting way before 5 years old. So they start very young.
So is this statistics in Malaysia or is it globally?
It's in Malaysia, quite similar to Singapore, about the same prevalence we have.
So, Dr. Jenny, if I'm a parent, right, when should I take my child to the doctors? And maybe you can share with us the signs and symptoms to look out for.
Okay, so as a parent, if let's say you have a child with a rash, I would think that it's important for you to bring to a doctor first to get a proper diagnosis. Because I know that sometimes I'm a mommy, I'm in the social media group, in the mommies group. Sometimes I do see that, parents will post the picture to ask for opinion from other mommies what to do. I think that first of all, you need to get your diagnosis right first before you can even talk about treatment. Because there are many other skin conditions that can look like eczema, but they may not be eczema. So if your child have a rash, I do think that first step importantly is to get the right diagnosis first. And if let's say your child has been diagnosed with eczema before, so when do you need to see a doctor? So if let's say you already have a plan, you know what to do, and you are confident in putting the creams for your child and all that, time when you need to see a doctor is when this plan no longer work. So when the plan no longer work, then you need to suspect on top of eczema, is there a secondary infection? Okay, signs of presence of skin infection will be like your usual regime doesn't work anymore, okay, despite you doing all the right way, or the rash appears different from usual. If your child has eczema, you will be quite familiar with how the baseline of your child's skin. So if let's say suddenly your child having very bad flare of the eczema, or suddenly there is a water bubble on the skin, or is more weepy than usual, then all these are the signs that the secondary infection is there on top of eczema. That's when that you need to bring to see a doctor to get it properly treated.
So Dr. Jenny, where are the common areas that eczema will develop for the child?
Okay, so for eczema, the clinical presentation actually varies with age. Okay, as you can see from this diagram, from the infantile to the childhood to the adulthood, they will present differently in terms of where the rash will appear. Okay, like this baby with eczema, commonly during infantile, less than 1 year old, the rash will be around both the cheek, okay, around the outers of the elbow, and also over both the leg, outer leg. Okay, as you can see from this picture, you can tell that the child actually is very itchy and trying to scratch. Okay, whereas when the child becomes bigger, entering into childhood, the eczema will be more over the skin fold, like the neck, okay, over the wrist. The wrist is still a skin fold, okay, over the elbow, front of the elbow, all right, over the neck, okay, you can see mainly is over the flexure and a little bit over the forehead. So when you look at this pattern over the forehead, you know that the trigger commonly is because of exposure to whatever that's at the air, like house dust mite. Whereas over the skin fold is commonly caused by the sweats. All right. See, behind the buttock fold there, all these are the skin fold where it will accumulate the sweats. So this is the pattern. And as they move on to the adolescent, adult phase, it's again quite similar to the child. It's all over the skin fold and over the forehead. All right. So these are the places where eczema commonly occurs, and they varies from the very young to the adult. They change. And adult, the other place that commonly happen is over the hand and the feet because of a contact. Some people that cannot tolerate harsh detergent, they wash hand very frequently, especially now we are facing with a pandemic, then you will notice that they come with a hand eczema.
Dr. Jenny, why is it so, right? I mean, at different ages, the eczema will develop at different areas. Is there a reason for that?
Okay, very good question. So different ages, their skin thickness is different. The exposure to the trigger will be different. Like for example, during the very young, they have it a lot over the face because these are the age where you have a lot of saliva, a lot of milk over your face. Whereas as you grow older, you are more better with your control and things like that. You no longer have saliva all over your face. That's why face is no longer a problem. Whereas more of the forehead because of the sweats and the exposure to the allergens in the air. Yeah. So depends on the skin thickness and also the different exposure of the trigger.
So is it hereditary eczema?
Okay, very good question. So yes, eczema is interplay between genetic means hereditary, plus environmental trigger. When these two come together, it will cause the eczema to flare. All right. So genetically, if you ask back, the parents or the grandparents, they bound to have somebody with allergy in the family. So doesn't mean that the child has eczema, the parents must have eczema. No. Allergy can be in other form, for example, like sensitive nose, asthma, or even allergy to food, allergy to medication is also a form of allergy. So when this allergy gene is passed to the child is born with very dry, sensitive skin with intact skin barrier. Okay, so because of this, they predispose to develop eczema when they come into trigger, the environmental trigger that will trigger the flare of eczema. So for example, most of the eczema don't happen at birth because when they are just born, just deliver, they are out from the mother's womb, where the mother's womb, everything is under control. The temperature is always the same, the humidity, the moisture, everything is always the same. So the skin has no problem because there's no sudden change. But when they come out to this world, they are exposed to different environmental trigger. That's when the eczema start to happen. That's why commonly you see eczema start to develop maybe about 2 to 3 months of age, whereas they were perfectly fine before that. So parents will say, how can this be genetic? My child is born fine. It's only later on that they develop. So yes, it's an interplay between genetic plus environmental.
So, Dr. Jenny, I mean, I have friends who have children who are asthmatic, they also have eczema. Is it interlinked?
Yes, like I say, any form of allergy will predispose them to have another form of allergy. Okay, so we always say a triad of asthma, allergy rhinitis, and eczema. They are the triad, they are like relative. So when you have one, you have higher risk of getting the others. Not necessary so, doesn't mean that, oh, no, this is the end of the world. I have asthma means I definitely will have eczema, I will have rhinitis. No, not necessary so, just that you are higher risk compared to the others in the population.
Is it contagious, Dr. Jenny?
Definitely is not. So it's a very wrong conception, unfortunately. I know sometimes the eczema rash can look very red and very scary, And I do hear that some child, unfortunately, they got bullied in school just because they have eczema. The friends, they don't want to be friends with somebody with eczema. They isolate them. They don't want to involve this child with eczema for the activity. So it's very sad. Yeah, we need to let the teacher know and the people around. In fact, everyone should know that eczema actually is not contagious. Yeah.
So is there a cure for it?
Okay. Unfortunately, this is a chronic condition. Like I say, is a hereditary genetic play a role. So it's unable to cure. It's a chronic condition. So there's no cure for it. But the good news is majority of them, in fact, 2/3 of them will become improved, will get better as they go on, as they grow up. The eczema will get better and improve, or in fact, the skin becomes so normal that you can't tell that they have eczema. So that's the good news. But even though when the skin there no longer has a flare, no longer has rash, but the skin is still sensitive skin. So if let's say, even though as an adult, if let's say they come into contact with very strong chemical, they may still have a little bit here and there of the eczema rash. But of course, it won't be as bad as when they were younger, when they were baby time.
Dr. Jenny, can you share with us some of the treatments?
Okay, yeah. So Management of eczema actually is a package. Okay, a lot of time I see that patient come to me, they say, doctor, I tried all the moisturizer out there, but nothing is effective. So that's not correct. So the treatment has to be a package. Okay, a package. What do I mean by a package? You have to do everything. You cannot just choose and do what you like and don't do what you don't like. Okay, so then the eczema won't get better. Okay, how to manage it? First of all, you have to do some investigator job. Okay, every eczema, if you look properly, you listen to the parent's history, you can identify some trigger that is causing the eczema. So it's very important for you to identify the trigger so that you can avoid the right one. Okay, I do have extreme of patient that avoid everything. Yes or no, also avoid everything. They avoid. The child very pitiful. They cannot go outdoor, they cannot play, they cannot eat a lot of type of food because just because they have eczema. So all these restriction is posed on them. So that is the extreme that I don't want. Every child deserves to live a happy life. Even though you have eczema is not something that is a doom sentence. You are not doomed. You can live like a normal child. Okay. So, but you need to identify what is the trigger of your eczema. So not everybody will have the same trigger. Some people, the trigger is this. Some people may have trigger of uh, food. Some people may have trigger of sweat. Some people may have trigger of harsh cleanser. So it's different. You have to look at the pattern by looking closely at the child's pattern. Like just now, the first picture of the baby that I showed. So clearly the trigger is because of the saliva and the milk. Yeah, so you have to advise the mother to put moisturizer before feeding. You must always clean away if let's say there is a saliva on the face. So you have to identify the trigger and remove the trigger. No point putting all the treatment, and on the other hand the trigger is still continue to stay there and trigger. So here you treat, here you trigger. Who will win? You'll go nowhere. Okay, so important is to remove trigger. Number two is to put a lot of moisturizer, because what happens in eczema skin is they have impact skin barrier. So when the skin barrier is impact, outside thing very easy go into the skin and cause problem. So by applying moisturizer itself, you repair the skin barrier and it can function properly. It can ward off all these unwanted allergen and germs from the outside to have a free passage to go in the skin and cause problem. So moisturizer is very important. Then of course, as I mentioned, eczema is a form of inflammatory skin condition. So of course, the treatment has to include an anti-inflammatory. Okay, so then only your treatment will work. It's a package, and of course include in the package also you have to break the itch scratch cycle. As I showed you already, eczema is very itchy and debilitating. If you don't stop the itch, you don't stop them from scratching, you again going nowhere, because itch is another form of trigger for eczema flare. So we need to break that itch scratch cycle. So to treat eczema, you need to have this whole package. Okay, everything need to be done. You cannot pick and choose. Oh, I just want to do this and this. Cannot. Okay, you have to do everything. Then only you will be successful.
So if you're prescribed, if the child is prescribed with steroid treatment cream, so is it harmful? I mean, if you use it too much, is it harmful? And also, does it actually cause dependency or also maybe withdrawal? That means you get immune to the cream and it doesn't work anymore.
This is the million-dollar question. Yeah, I think a lot of parents that has a negative perception about this steroid cream. Okay, however, I need to tell you that topical steroid is still the mainstay, it's still the treatment. for eczema flare, but it's during the acute phase. If let's say we manage to bring things under control, we can move on to the maintenance phase where we can talk about non-steroid cream. But during the acute phase, we still need to depend on steroid. Okay, but don't get wrong. Okay, I know with social media and all that, it doesn't help. So sometimes I really need to spend a lot of time to sit down with the parents to correct their perception about steroid. Steroid, there is not just one type of steroid. There are so many different types of steroid in the market with different strength. So when I choose which kind of steroid to use, I will consider the patient's first age. Where is the location to apply? The cream that I choose for face will be different from the cream that I choose for the hand, because the skin thickness is different, and the safety I need to consider. So that's why I need to see the age, the location where to apply, and the severity of the eczema. If the eczema is very bad flare, very angry looking, of course I will use a little bit stronger one for a while and then taper to a lighter one when things under control. Yeah, but if let's say they come with only mild one, then I can start with a very mild steroid, or even I can escape using steroid and straight away use the non-steroid cream. Yeah, so don't worry. If you use the creams according to the doctor's advice, it will be very safe because you always under the doctor's monitoring. Okay, just like fever medicine, TCM, paracetamol. Yeah, you use it for fever. If you use the right quantity, you will resolve the fever. But if you take the whole bottle, isn't it committing suicide?
Yes, yes, yes.
It's the same analogy. Steroid is a very wonderful drug, it's a wonderful cream to use for eczema if you use it correctly.
So, Dr. Jenny, earlier you mentioned that parents sometimes they go to the extreme. They completely change the child's diet, hoping that the condition will actually improve tremendously. But the actual change of diet or food restriction actually will cure eczema?
No. The answer is no. Because, well, child with eczema, they have a risk of having food allergy. But not all child with eczema will have food allergy. So that one we have to be clear. So if let's say the child has no food allergy, we are only doing harm by restricting them from all different sorts of foods. So we need to verify. Okay, do see your doctor. If let's say you have suspicion, that your child you think that your child has some form of food allergy, clarify it with your doctor. So that your doctors can verify, is it really so your child has a food allergy that you need to avoid this kind of food? Or all this while you are just, devoiding your child the joy of eating. So for food allergy, commonly they have very specific symptoms that your doctors can detect. After eating a certain kind of food, within 4 to 6 hours, they will develop a reaction like hives, swollen eyes, swollen mouth. These are the signs of food allergy. But a lot of time, what happens is a parents may have a perception, okay, I think this food, for example, egg, this food will cause allergy to my child. So when you give your child egg, you will watch closely. The moment your child scratch only, you say, this is the one that caused food allergy. But like I mentioned earlier, eczema actually is itchy. You don't feed your child anything, you fast your child will scratch if the eczema is there. So it's not due to allergy in that case. So we need to verify. First of all, is your child really have food allergy before you putting any restriction on your child? If let's say really there is a history that suggests that your child has a food allergy, then the doctor will proceed on to do the proper test to confirm your suspicion. Is it really the child is having this food allergy, and will advise you, do you need to avoid? So don't do unnecessary food avoidance or change the diet just because you hear that, oh, protein will cause allergy. No, don't do that. Okay, it will just devoid the child of the joy of trying all sorts of food.
Isn't it better to do a food allergy test?
Well, I won't suggest for food allergy tests for all children with eczema. Like I said, if let's say on the other extreme, you just blindly do the test for food allergy, it will be very difficult to interpret because it's like now, for example, I do a food allergy test for you or me. We may have one or two positive results in our test, but we have been eating the food every day without problem. That doesn't mean we have allergy to the food. That's why an allergy test have to be interpreted carefully together with the history, the relevant history suggestive of a problem with that food. Then together with the test, yes, the test is positive for your suspicion. Then only you can conclude this is food allergy. Blindly doing this kind of test will definitely not help. In fact, will do more harm. Then end up they will avoid everything that is positive in the result. Okay, yeah. So I won't suggest. And in fact, most of the child with mild eczema definitely is food is not the number one cause that we should think about. And the other thing, like I said, every eczema actually has a story behind it that we need to decipher. By looking at the pattern of the rash, you actually can guess what is the trigger and not blame everything else on food as what we Asian, Malaysian like to do. You know, this one sure food allergy. No,
Yeah.
that's not the case. Yeah.
Yes, very true. So, Dr. Jenny, what are the preventive measures, for future eczema flares?
Um, okay, preventive measure, like I mentioned earlier, is quite the same.
The
Like
same kind of
for management.
okay.
So for prevention, of course, you need to identify the trigger and prevent it. When you prevent the trigger no longer there, then your eczema will be okay. Okay. The other thing that, for example, like for young baby that is born, if let's say their parents have history of allergy of any form, maybe nose allergy, asthma, allergy to medication or food, I would advise them to start applying moisturizer for their child from very young, because study has showed that the earlier you start applying moisturizer, the earlier you repair the skin barrier, it will prevent them from having eczema. Or if let's say they do have, it will be not so bad in a milder form. I see two different group of parents. Okay, nowadays with more awareness and people are more well read about this condition, a lot of parents actually bring in earlier. They bring in when start to have rash, they already bring to seek treatment. So which is very good. You know, the awareness is there already. But however, I do see parents that bring in very late, because when I ask, why mommy, why you bring in so late? You know, the child has been suffering for so long and the eczema has gone so bad. So some of them actually tell me that, I heard that they will outgrown the eczema as they grow up. So they thought that, just let the baby have it and they eventually will outgrow it. Yes, like I said, two-thirds of them actually will outgrow it. But while they outgrow it, you shouldn't let the child suffer. We should get some form of treatment so that the child is still enjoying the sleep, undisrupted sleep, will not be scratching away and until bleeding. Sometimes the child scratch so much in the morning when wake up, the parents actually find that their sheets are blood stained. That's very distressing to watch.
So, Dr. Jenny, lastly, is there anything else you wish to share with the viewers?
Okay, so so for parents with child with eczema, like I say, this is not a doom sentence. Yeah, the eczema can be very well controlled. Just you need to seek treatment. Okay, a proper a doctor that willing to sit down with you to analyze your child's skin condition, to identify what's the possible trigger, so that can advise you what to avoid and not avoid everything unnecessarily. Okay, every child, like I say, deserve to enjoy their childhood. Don't devoid them of a happy childhood. So eczema is definitely one condition that don't underestimate it, although it's not life-threatening, and but it can impact the quality of life, not just for the child, but also for the caretaker. So don't get yourself into that, because this condition can be treated, can be controlled. And for parents with child with eczema, I know this is a chronic condition. Sometimes taking care of the child may be quite a hassle. You need a lot of your time and effort putting in to get the child's skin better, especially those that have a bit more severe eczema. Don't feel frustrated. Okay, do reach out to ask for help. There are support group out there for eczema. For example, Malaysia Eczema Society, where you can meet many parents that have child with eczema, where you can exchange notes, get a little bit tips on how to handle difficult situation, and supporting each other. I think is very good. Because parents, you are also human. You have your frustration, you have your limit and things like that. And dealing with a chronic condition, you definitely need all the support out there.
Thank you for taking the time to be on our show, Dr. Jenny. I've been speaking to Dr. Jenny Tan Yan Ling, consultant pediatrician and pediatric dermatologist at Subang Jaya Medical Center. This video will be on our Facebook and LinkedIn site, as well as on our website, www.biztech.asia. Please check out our website for business and technology conversations.